Hello, everyone, and welcome to the MGUS Smoldering Myeloma Patients chapter. My name is Audrey Burton-Bethke, and I'm the Myeloma Crowd Community Manager. And this is brought to you by the Myeloma Crowd Community Program by HealthTree. I'm going to start by sharing some slides with you. You'll just give me one moment to pull those up, and we can get started. So as I mentioned, this is the MGUS Smoldering Myeloma Patients chapter. I'm really grateful for your support, your participation here today. Today's session will be recorded, and the recording along with the slides will be sent out to all registrants within 48 hours after the event has concluded. As always, I would like to thank our sponsors, without whom this would not be possible: Bristol Myers Squibb, Takeda Oncology, Karyopharm Therapeutics, Adaptive Biotechnologies, Oncopeptides, Janssen Oncology, AbbVie, Sanofi, Amgen Oncology, and Genentech. Today's agenda is as follows. My introductions will just continue for a couple moments, and then our featured speaker, Dr. Jens Hillengass, who I will introduce formally in just a moment, will give his presentation. Then at 7:25-ish p.m., Eastern time, we will start the question and answer session. This is a wonderful opportunity to ask a multiple myeloma specialist some of the questions that you've been having, specifically about fitness and what you can do in order to participate in this critical myeloma research. I forgot to mention today's session is only scheduled for 45 minutes. Today's topic is studying the relationship between fitness and myeloma progression. We often get the question, what can I do to decrease my risk of myeloma progression? Currently, there are speculations about proper diet or proper fitness levels slowing progression, and Dr. Hillengass has made it his mission to study this relationship to find real answers for precursor patients who are anxious to do more. It is now my pleasure to introduce our featured speaker to you. Jens Hillengass, MD, PhD, is a professor of oncology and chief of the Myeloma and Amyloidosis Service at Roswell Park Cancer Institute in Buffalo, New York. Prior to joining Roswell, he was the deputy of the section of multiple myeloma of the University Hospital of Heidelberg, Germany, the leader of its autologous stem cell transplantation program, and head of the Hemato-Oncological Imaging Research Group at the German Cancer Research Center. He completed his medical degree at Heidelberg University, where he later completed residency and fellowship in the Department of Hematology, Oncology, and Rheumatology. Additionally, he completed a research fellowship at the National Cancer Institute. Dr. Hillengass, thank you so much for joining us today. It's such a pleasure. If you want to turn your camera on and talk to the group, we're really excited to have you here today.
I'm also very excited. Is the sound okay, or should I rather use headphones?
No, this is great.
I'm in my office, and it might be the light is not great, but I'm much less pretty than Audrey, so it's not not that much of a loss. I have my big screen, which actually should illuminate my face a little bit.
No problem.
Should I just start sharing my screen? I think that makes sense. See, at the moment it shows the raw, sorry.
While you're waiting, I'll just kind of talk about the Muscles for Myeloma challenge that we have going on quickly now that you have your slides up. It's a 30-day challenge, and I will be sending out in the follow-up email how to join this fitness challenge to celebrate blood cancer awareness. And that's part of why we wanted to do this event in September, is to celebrate or honor Blood Cancer Awareness Month and highlight this Muscles for Myeloma movement challenge that we have going on to get people more fit. So that is why the background behind the scheduling of today's meeting. So we're really excited again to have you here.
Thank you so much. Do you see the full screen? Okay, yeah. Excellent, good. Hello, everyone. Thanks for dialing in today. And this is something that is very near and dear to my heart. And part of my presentation will be about why do I do this and why do I think it's important for you. Studying the relationship between fitness and myeloma progression. I have kind of divided my short presentation, no worries, will not be too long, into what was the motivation, why do I do this, why do we do this as a group, to also present some knowledge about what we have already available, current projects we are doing, and the project we would like to do together with HealthTree, and then future plans beyond that. Our motivation. So my motivation started many years ago when my patients, I started treating myeloma almost 20 years ago back in Germany. And at that time we had 3 drugs, melphalan, prednisone, maybe dexamethasone, and then thalidomide, which was the new kid on the block. And some of you might have heard of those drugs. Most of you, I know most of you are not in treatment right now, which is great. And it should stay that way. But patients over the time, as you know, we got more and more treatment options, and patients live longer and longer, which is again great, and I am very grateful for that. But then my patients asked, what can I do? As Audrey said, what can I do to make me feel better? And also, when can I go back to the gym? When can I go back to the golf course? When can I go back playing tennis and whatever they did before? And I always had to say, I cannot tell you, because there's no data, there's no studies. Your bones might be brittle because of your myeloma, and I just don't dare to allow you anything. But my patients were very persistent, which is great. They told me we still want to do it, and later on we put out some questionnaires and learned that the patients do it anyway, even though I didn't allow it. And surprisingly, or maybe not surprisingly, not a lot happened in a bad way. Quite the opposite, actually. The patients reported that they feel much better. Their quality of life improves, their general fitness improves. But again, there was not much data, so I could not, from my perspective as an academic physician, say, okay, this study says you should do that and that this will happen. We just don't know it. And there's always the risk of fractures, of course, in symptomatic myeloma, and also the risk of infections. As you know, gyms are not always the most hygienic area that you can go to. A lot of patients found ways around that. They went early in the morning when it was cleaned, or they went to the swimming pool early in the morning, or they found someone who had a private swimming pool and all of that. So there were ways around it, and that basically motivated me to say, okay, my patients do it anyway, so I want to be able to tell them more. So that was my major motivation. What do we know so far? We know that myeloma obviously can cause bone disease. One initiating factor, or the actually most important initiating factor, is an imbalance of the bone-eating cells, the so-called osteoclasts, and the bone-building cells, the osteoblasts. As you know, there's a disbalance in multiple myeloma, and that can cause bone lesions, holes in the bones, osteolytic lesions. But beyond that, there's the knowledge now that the myeloma cells and the bone-eating cells, especially, as you can see on this graph, are communicating. The myeloma cells overactivate the bone-eating cells, which then leads to the osteolytic lesions or osteoporosis. But on the other hand, osteoclasts also reactivate multiple myeloma cells. And what has been shown mostly in animal models, in mice mostly, is that if you have myeloma cells in remission, like when a patient is in remission, also a mouse can be in remission. And if you stimulate the osteoclasts, those osteoclasts basically wake up the myeloma cells out of their senescence. So there's kind of this vicious circle that myeloma cells activate bone-eating cells and bone-eating cells activate myeloma cells. You know that we treat that, and we treat the myeloma, we treat the bone-eating cells with the bisphosphonates, but so bone is basically what we learned from that. Bone is very important in myeloma. And now we are talking about MGUS and Smoldering, or to MGUS and Smoldering patients. There is even data, which is actually pretty old already, that there is a higher risk of fracture in patients with MGUS. higher than expected. It is not really explained why. This study has been done, as I said, several years ago. It is not really clear, but statistically, an MGUS patient has a higher risk of fracture compared to someone who has no MGUS. Risk factors, you can see on the left, if you had a previous fracture or someone had a previous fracture, that increases the risk. If patients are taking long-term corticosteroids like dexamethasone, prednisolone, or if their serum calcium is low, or if they are on other drugs for other diseases. So there are risk factors even in MGUS. So we think there's even a connection between bone and myeloma or bone and MGUS in very early stages of the disease. What we also know, these are astronauts. When they came back from their first flights into outer space, they came back and had very low bone density. The reason for that is that they were not exposed to gravity anymore, and gravity and impact are kind of stimuli that keep our bones strong. If a bone, like a muscle, is not used, or a brain for that matter, if it's not used, it will deteriorate. So what they have learned, they have to train, they have to do resistance training in space to keep up their bone density. And it happens actually pretty fast. Some of you might have had a fracture in your life, a bone fracture. And when that heals, you see that the muscles shrink, but we also know that the bones kind of lose some of their density. This is also reflected in some studies where exercise has been performed by healthy individuals. And they compared here in this study, again, rather old study, they compared running, swimming, and a control group of patients who did nothing. And you can see here the control group, they they gained more body weight, and they also measured bone density. This is not in this graph, and it was not in the as a graph in the paper, but they saw that swimming and doing nothing, unfortunately, was almost the same effect, while the running, which is an impact sports, had more effect. This is more about body weight, but in the same paper, they found that swimming and control had less effect on the bone density than running, because running uses gravity. When you're swimming, you lose this effect of gravity, and it's something that we again see also in astronauts. Another factor in myeloma is that we know that patients who are obese, who are overweight, have a higher risk to die in general from cancer, but this is also true for multiple myeloma. So, and it's both true for men and women. And as you know, exercise can help you to lose weight, not alone mostly. You usually also have to adjust your diet, but this is not the topic of this talk today. But in general, obesity is also related with a higher mortality in general in cancer, but also in myeloma. And even the risk to develop multiple myeloma is correlated to obesity. Another very important part, as you know, is the immune system. Myeloma is a disease of immune cells, and therefore, please don't read the whole text. I will summarize it. The immune system keeps any cancer, but specifically myeloma and other hematological diseases, under control. Usually when we develop a cell that is wrong, for example, a cancer cell, our immune system detects that and kills this cell, because the immune system is trained to attack everything that is not normal and not self. So everything foreign, like a splinter in your finger, will be attacked by the immune system. So in myeloma, we know that so-called dendritic cells are part of the immune system. They promote the growth both of healthy plasma cells, but also of myeloma cells. NK and CD8 positive T cells, which are cells that are usually kind of the fighters. They attack foreign cells or kind of strange cells that they don't like, that they don't detect as normal, and including cancer cells. These NK cells and the CD8 cells are important to kill wrong cells, or also to also kill germs for that matter. And they are used when we give our patients proteasome inhibitors, PIs, or immunomodulatory drugs. You might have heard of bortezomib, Velcade, or carfilzomib, Kyprolis for the PIs, and you might have heard of lenalidomide, Revlimid, or pomalidomide, Pomalyst as IMiDs. There are so-called tumor-associated macrophages, another group of immune cells, and some of them are pro-tumor, others are anti-tumor. And in myeloma, we see that there's the pro-tumor and the immunosuppressive ones are overactivated. Same is true for myeloid-derived suppressor cells. Again, suppressor cells, they suppress the immune system and they suppress the anti-tumor immunity. And they are also active in myeloma. And the last is the regulatory T cells. Their job is in part to stop the immune system to overact. For example, when patients have an allergy, that's an overreaction of the immune system, and those Tregs are supposed to suppress that. That's the healthy part, but sometimes they suppress the normal immune system effect against cancer cells. So these are all cells that are relevant in multiple myeloma as they are in a lot of other cancers. And there's a study published recently by the Dana-Farber group, Irene Gabriel. You might have heard her giving talks. They're amazing. I can only recommend that. And they have looked into patients with smoldering multiple myeloma compared to normal controls. And they looked again which of those cells are enriched in the tumor microenvironment in patients, in this case with smoldering myeloma, versus normal. And you again see on the right side this tumor microenvironment with the NK cells, the T cells, and these monocytes are macrophages. So there's a relevance even in earlier stages of the disease. Now, what can the immune system, or what can we do to the immune system to make it stronger? That's a question that I get all the time from my patients. What can I do to improve my immune system? And this shows what effects exercise, physical activity has on the immune system. You can see that the T cells that I mentioned earlier are inversely, those regulatory are inversely correlated with exercise, and even a short exposure of aerobic physical activity. For example, they measured patients, I think they walked 10 flights of stairs, and they measured this cytotoxic activity of the T cells before and after, and there was an increase in that. NK cells that I also mentioned, the natural killer cells, they literally kill cancer cells. Their number and activity can be positively influenced by exercise. And again, those macrophages and monocytes, it's kind of one group of cells. They can be decreased, these so-called inflammatory monocytes that chronic inflammation again can cause MGUS and then can cause smoldering myeloma and myeloma. So it reduces this chronic inflammation if we perform physical exercise. Now to the current knowledge, there have been studies, and this is, in my opinion, the best one, the Xgeva study, the Xgeva trial. Patients after high-dose chemotherapy and autologous stem cell transplantation were randomized into exercise of 18 weeks versus standard of care. They just followed with their doctor, and they measured before and after the intervention, and then they looked for certain markers. The problem is that the Xgeva study was negative, so it didn't show any benefit of exercise. A few things that I think personally might be, and it was also discussed in their paper, some things that I think were kind of influencing this non-superiority of the exercise was they had counseling sessions in both. We know that counseling is also positive, and again, a topic for another talk. We know that physical stress also lowers our immune function, which then can cause negative effect. Other things where I don't think that the 16 weeks that they have done was long enough, because as you know, it takes us a while to get into the exercise mode, and then at one point we see the results. So I think the 16 weeks, of course, they are limited by funding for research and so on, but I think that was just a little bit too short. And we also know that a lot of patients, or they kind of described that a lot of the patients in the control group actually got physical therapy, which is also kind of a physical activity. And then the compliance was not so great. We are trying to figure out how that is, but you all know that it can be challenging to follow a strict exercise routine over a longer period of time. And I will tell you how we deal with that. But it is definitely something that might also have had an effect on the outcomes of the Xgeva trial. If you look into the medical literature further, knowledge that we have. Unfortunately, most studies were very small, like 20 patients, which is a good start, but it doesn't give us too much of an insight. Sometimes the results were very kind of vague in a sense of, yeah, patients feel better, but the question is, what does that mean if a patient feels better? Does it really have an effect? Oftentimes low numbers of patients, as I said, need confirmatory examinations later on. Significant findings, oftentimes it was mixed exercise or home-based exercise, which of course is something that is also important nowadays in COVID times. So we still have to deal with that, but oftentimes it's more difficult to follow something at home than when you have an appointment in a gym or in a clinic. Lean body weight, muscle strength, and nighttime sleep were increased. So that's a good thing. We see muscles grow when we work out. Again, not too much of a surprise, but this is also true in patients with multiple myeloma. Patients needed less transfusion. One thing is that this might be a stimulation. You know that also like bikers or runners have a higher hemoglobin, have a higher capacity to use their oxygen. So that's something that might be beneficial, but of course, if you are on treatment, you cannot run a marathon, or some do, but most don't. The limb strength gets better, which is something I think is important, because muscles not only are strengthening themselves, but also strengthening the bones, which is kind of a shear effect there. And fatigue is a very important topic. And I have the experience that, and please tell me later on when we are discussing, I have the experience that fatigue is already present in a lot of smoldering myeloma patients, sometimes even in Angus stage. I have seen that over and over again. And I'm oftentimes hesitant to treat a patient just because of fatigue, but I know fatigue can have a huge impact on the quality of life. So this is something where exercise has shown to show benefit. Further literature review, oftentimes the recruitment goals of those studies was not achieved. I have to say we have enough patients who are interested, so I think, and I'm happy to hear what you have to tell me if you would be motivated to do such a trial. Oftentimes it is during chemotherapy, and as you know, chemotherapy can have a significant impact on quality of life. And if you do exercise and chemotherapy, sometimes the effects of the chemotherapy might outweigh the effect of the physical exercise. It was partially supervised long-term exercise training that should be more effective than a short exercise training for only a few weeks and maybe home-based, where you don't have a lot of motivation sometimes, as I know for myself. And oftentimes what we think, it has to be very personalized, especially in symptomatic multiple myeloma, because if there's a fracture risk in an area, we should not train this body part. I think it will be much easier in patients with smoldering myeloma and Angus. What we are trying to develop with HealthTree, and I have to admit we are not as far as we want to be, we have done one thing. We sent to HealthTree a few questionnaires, and we have already some responses, actually a significant number of responses. I'm very grateful for the team from HealthTree who helped us significantly with that. We asked our patients, and I think you can still fill those in. What was your exercise before your diagnosis? What is your exercise now, your exercise level, and what would you like to have in the future? And also, how important is exercise, physical activity for you? And what we found, we got back 678, which is a really good number of patients, of questionnaires. And most of them were multiple myeloma patients, some smoldering, some MGUS. Median age was 64. That reflects not exactly the median age of first diagnosis, but rather the median age of people who are tech savvy enough to fill in the questionnaire online. Most of a little bit more female than male, which is also what we oftentimes see in questionnaire studies. Unfortunately, I have to say mostly Caucasians, because as you know, the representation of myeloma is much higher in the Black population. Unfortunately, we don't reach these patients as well as we should yet. But I'm working on that too. And I think HealthTree does that too. I know that Greg Broside is very engaged in that. And most people had a higher degree of education, which again might reflect the willingness to fill in an online questionnaire. What we found too, if we ask, okay, how many patients had more than 2 hours of physical activity per week? Before they were diagnosed, 82% reported that they did that, and at diagnosis, 64% only showed that. So you see a significant step down because of the diagnosis, maybe because of distractions, maybe because of symptoms, maybe because of side effects of treatment. And 90% of patients said they would like to do more. So more than did before, wanted to do more when they are feeling better. And if we asked, is physical activity important for you? Almost everyone said, yes, it is important or even essential. What we are currently doing at Roswell, we have started a study with 2 cohorts that will close soon, but we will open a new one based on these results. Our first cohort is a supervised resistance training at Roswell Park in our rehab department, where we have strength machines and aerobic machines. And the other cohort gets a Fitbit, which is a wearable, like a watch that gives you, that counts your steps. And we can send prompts via SMS or via text or via Fitbit directly. And we want to motivate our patients to walk X number of steps and be a certain number of minutes active per week. What we're looking for is the immune fitness of the patients before and after the bone turnover. We haven't had the funding before. Now we have it in our new study. We will do that. And we definitely look into quality of life. I don't have the results back yet. We have some preliminary results that are very promising regarding the immune system. They confirm what I have shown earlier, that has been shown in earlier studies, that some cells are more active and more prevalent, but that needs definitely more examination. And these are some statements. This is our rehab department, some statements from patients where one patient, those were all active myeloma patients. One patient said she could open the juice bottle again, which she couldn't before. Another one said she can reach the upper shelf in their kitchen, which she couldn't do before because she couldn't stand on her toes. Someone said after chemo, he's very tired. And now since he's working out, he feels better. It should be worse, but it is not that much anymore. So it helps with his fatigue as a side effect of his treatment. And what I know for myself, a lot of patients say their mood just gets better. And my wife is actually the exercise trainer. She's a nurse by training, but she kind of went on to become a personal trainer. And she's training the patients, and she tells me stories that they have a lot of fun with each other. They motivate each other. And I think that's an important part, the social aspect. Of course, COVID was a huge hit for us because we couldn't put that many patients in one room anymore. Now we are down to the maximum of 4 in this room. But of course, we hope that we can improve that soon. And we also hope that we can develop a home-based training where we use something like we use right now, the Zoom or another company, and can do a supervised training at home, but with still the effect of the social gathering, basically, which is virtual, but better than nothing. So those are our future plans. We want to have a longer duration of 6 months instead of the 16 weeks that the EXIT study did. We want to do these promptings together with resistance training. Promptings meaning please walk X number of minutes per day. And we will definitely look into more lifestyle and quality of life questionnaires. We will get blood samples and look for immune system function, for stress. There are also signs that stress has a negative effect on the immune system and on myeloma. And we also want to look into markers of bone disease. So now I get a dry mouth, and I think it's time that you can ask questions. I thank you for your attention. I thank my team who is working with me, without whom I could not do anything, literally. And I thank you for your attention, and I'm happy to start the discussion now.
Wonderful. Thank you so much. I thought that was a great review, and I appreciated how you started in the beginning about what's happening to the bones and myeloma and why it's important to use that impact exercise to increase bone density where we can. Let's start with some questions because I know people have a lot to ask you. So is there anything, Paula is wondering, is there anything that we can do to increase our hemoglobin? When we're working out, is taking iron supplements recommendable? Like, I don't know if that's the word. I made that up. He didn't say that.
Oh, that's okay. That's actually, it's a good point. There is some data. Sorry, I just have to turn off my presentation because it's always popping up again. There is some data that the hemoglobin can go up with exercise, mostly with aerobic exercise. Iron is only recommended if you have an iron deficiency, and that's very easy to measure, and your physician can do that easily. Even your primary care physician can check your iron levels. If your iron level is not low, then you should replace it. If it's not low, then you don't have to. And exercise might contribute. Unfortunately, I mean, I'm very excited about exercise. I do it myself. I love it. It is a little bit less effective than we want to. And sometimes the studies have been done with young athletes who are marathon runners to begin with. So it's sometimes challenging to extrapolate to something, to someone who is kind of a normal person like myself or you. Yeah. So that can be challenging, but there are signs that improved physical activity, and even if not the hemoglobin is going up, the utilization of the oxygen is getting better because your cells learn to utilize the oxygen.
Oh, wow. Okay, awesome. John brings up a good question, and I think this is one that lots of people have on their mind. What about Zometa or these bone strengthening medications? Are they recommended, and would they help patients be stronger for treatment?
Yeah, so in symptomatic multiple myeloma, definitely yes. It is recommended even in patients who have no bone lesions, no visible bone lesions in CT or MRI. They are important because as I have shown you in this graph initially in the beginning, where these myeloma cells and the bone eating cells are interacting, that is, when we treat myeloma, we kill the myeloma cells with our chemotherapy or immunotherapy, but we can also kind of attack this other side of the vicious circle where we can reduce the effects of these bone eating cells, which is good for the bones, but it's also good against myeloma actually. So this bisphosphonates should definitely be used. There are unfortunately also side effects, like for example, this infamous osteonecrosis of the jaw. But I think there are better talks or better topics where you can read that up or look at that. And the question is, in smoldering myeloma, there have been studies in the past. Unfortunately, the data is not really convincing. It didn't really show a benefit. So at the moment, it's not recommended to do it in smoldering patients. I know a study close by, Dr. Leib in Rochester, University of Rochester, is doing a study with Denosumab, which is a so-called ranked ligand inhibitor, similar mechanism of action than bisphosphonates. And she's doing a study in smoldering patients. I think she's fully enrolled already. So, but she will bring out data if that has an effect, a beneficial effect on smoldering patients as well.
Wow, fascinating. Okay, thank you. There's a question from Jessie. She says, for those with MGUS or smoldering myeloma, can the levels of osteoblasts and osteoclasts be measured? And would there be a practical value in doing that?
Yeah, we do that in clinical research. We have started, independent of the exercise topic, we have started to do biopsies of osteolytic lesions because we think that the myeloma is not one myeloma everywhere. And we have found that there are differences in different areas of the body, and we do that CT guided. We don't exactly count the osteoblasts and osteoclasts because that is even more heterogeneous. In some areas, there might be a cluster. In another area, there might be none or almost none. So we do see that there are more osteoclasts. At the moment, it is not, if they don't cause holes in the bones causing osteolytic lesions, then it does not really change a lot on our knowledge about the disease or our management about the disease. So I personally think you don't have to count them. There are a few measures that can be done. They are not very reliable yet. And that's part of our new study that we want to see, okay, what are the changes with which markers that we can just measure out of the blood. We don't have to kind of take a bone biopsy to count these cells because they're only in the bones. They're not in the blood. we want to measure certain messenger proteins in the blood that then give us kind of indirect information about how many osteoclasts and osteoblasts are there.
Okay, fascinating. Barbara and Ricky are both kind of wondering the same question. What kind of exercises count? Barbara's wondering about walking and Ricky's wondering about an elliptical. Are these kinds of exercises going to make a difference?
Yeah, definitely. So there are, as you know, we can differentiate very, very roughly into aerobic exercises and resistance exercises. One are more building strength, others are more building aerobic abilities. Actually, especially for MGUS and Smoldering, walking, which has some kind of an impact, because every time you hit the ground with your foot, you have a slight impact on your skeleton, is beneficial. We know that impact, as I said, with the astronauts, they have no impact anymore because they float in space. So here on Earth, when we walk, that is good. The elliptical is also good because it's a whole body workout, because when you also use your arms, so that's beneficial for your muscles. For the bones, not that much. So what I usually recommend, and again, this is more based on literature more than our own data, is that some impact is good, especially in Smoldering and Angus. In multiple myeloma, we have to be careful. Running in multiple myeloma might already be too much if patients have, for example, lytic lesions in their spine. So always, if you have multiple myeloma, then you should talk with your physician if what is allowed. In Angus and Smoldering myeloma, as long as you don't have any bone lesions, then running or impact sports that are good. But everything counts basically, because you improve your cardiac strength, your vascular strength, your pulmonary strength, which then helps your immune system, which then hopefully has an impact on the myeloma.
And not to mention too, you lower your risk of comorbidities, right? So also
Absolutely.
improving your health in other ways and lowering the risk of other diseases as well.
Yeah.
How much exercise do we recommend a week to see benefits? And
It depends a bit on the level of exercise. I don't know the current numbers, but you can easily Google it at the CDC. They have guidelines. At the moment, to my knowledge, it's 300 minutes, active minutes, and that can be moderate, or 150 minutes strenuous, I think. I would have to look that up. I should know that better, but it changes once in a while. So the 300 minutes, I think, is what I have still in mind. Yeah.
Okay. I'm making a note to look it up ourselves and send it out in that resource email that we send. Jan is asking a great question. She's saying she has stable but medium risk MGUS, has osteoporosis, it's being treated, but how can she safely tell how far she can safely push herself with weight bearing or impact exercise without risking a fracture? And what kind of medical specialist should she be consulting about with this?
Yeah. So whoever does a bone density scan, because the bone density scans there nowadays, they have so much data, because osteoporosis is a very common finding compared to multiple myeloma. And in osteoporosis research, there's a lot of knowledge about what level of bone loss over time has what risk of fractures. So that is actually in our DEXA scans, or these bone density scans, they even give us kind of this information: patient has a risk of XYZ percent to develop a fracture. So the specialist, it depends. Sometimes it's an orthopedist and sometimes it's an endocrinologist, because oftentimes, as you know, elderly persons, individuals, and especially women, because of the change of the hormonal landscape, have a higher risk of osteoporosis. So an endocrinologist might be the expert. Sometimes even a gynecologist might be able to give some insight. And a lot of primary care physicians also have some insight into that. So a DEXA scan or a bone density scan would help with this question.
Okay, perfect. One question that I found interesting was Elmore saying they have smoldering myeloma, and they cycle at least 100 miles a week. So their question is, can excessive exercise be detrimental?
Yeah, that's an amazing question. There have been waves of discussion in the exercise world for this preparation of our study and this talk. I read a few papers. There was a study where they did not cycling but marathon runners, where they tested their immune system before and after the marathon, and they were shocked because now after the marathon it was worse.
Wow.
And there was a huge discussion. I don't know, I think it was in the 80s where they said, oh no, you cannot do a marathon anymore, it's dangerous for you. Later on, they found it was a temporary change, and later on the recovery was actually better. So 100 miles is impressive, so respect. I think for everyone who doesn't do that, I think you don't have to do that. Personal experience, not in myself, but in another patient, and you will find him online as well, crazy guy on a bike. He's a patient who also came to our Ride for Roswell, where we have a benefit, fundraising ride. And he also rides hundreds of miles on his bicycle. And he's in remission for over 10 years. So that's an N of 1, so it's not a study. But I think longer term workouts are good if you can do it. You don't have to do it, but I don't think that it is wrong. I would maybe not do an ultra marathon through the desert, what people do nowadays, because that's really not good for your body. But if you feel good, if you are feeling well after you did that or during you do it.
Okay, awesome. I have to tell you, there are a lot of questions. So if you don't mind staying a little longer than originally planned, they definitely came prepared with questions, let me tell you. One attendee is wondering, how safe is open water swimming in a lake? That's an interesting question.
That again depends very much on what stage you are in. If you have a normal immune system and your physician can tell you, or kind of normal immune system, then you should be okay to do that. If you have multiple myeloma and are possibly even on treatment, I would be very careful with that, because as amazing open water swimming is and how good it feels, there are germs in the water. Swimming is actually great because it doesn't put any danger on fracture risk, as long as you don't bump into someone. But swimming again has the downside that it doesn't have any impact. It takes away the effect of gravity. And we know that some impact and some effect of gravity is important for the bone density. So it is great for cardiovascular again, as you said, and also helps to burn calories and reduce obesity. But on the other hand, it lacks this. It should not be the only thing you do.
Okay, more impact exercise is necessary.
Correct, if you don't have bone lesions. Yeah.
Right. Okay, another question is, can intense exercise increase inflammation? And if so, how does one find that sweet spot?
Yeah, that is what I discussed earlier, where they said with these marathon runners, and they tested it in others. It was not really proven that this is the case. It's difficult to measure. There are measurements, but they are very complex, and you have to, catecholamines, for example, you can measure, and then you can see what's the effect on the steroid level in your body, and so on and so on. That's very complex, and they only do that for, I don't know, high-end athletes, where it might make some sense. As long as you feel well and don't feel stressed, I would say, and that's very vague, I know, but as long as if you feel afterwards maybe tired, but not worse than you did before, I think that is kind of for us lay people and for us kind of leisure athletes, that might be a good level, and that's not scientifically proven, but there is a too much, but I think it takes a long time to get to this too much.
Okay, thank you for that. Because there's another question from Angie. She's wondering, kind of on the other side, First of all, there was a lot of comments saying, thank you for acknowledging that smoldering myeloma patients and even MGUS patients can have side effects, because often it gets pushed aside. Oh, no, you don't have any
Oh, yes, yeah, I know.
conditions. So
It's
lots of patients are grateful that you spoke to that. She is one of those patients that has fatigue. She says she tries to walk 3 miles a day, is starting strength training and Pilates, but is feeling that fatigue. So how does she know what type of exercise is best and how much she should do? I think it's kind of the same question you've been giving, but I did want to highlight her question.
Yeah. Actually, to my knowledge, the only scientifically proven intervention for fatigue, both in cancer but independent from cancer as well, is actually physical activity. And there is a try and error. My experiences with our patients in the study and in my personal life, do what you like to do. If you have to force yourself and to kick yourself in the butt to do it, it will not really work. Another, and that's very general, another thing is what we have learned, that if someone else does it together with you, that's also helpful, because then you have an appointment, I don't know, twice a week, and you know, on, I don't know, Thursday at 6, I meet with someone and then we go walking. And that is something what also helps, and that's not a promotional, but also in my experience are these fitness trackers that you get everywhere now, and they're not that crazy expensive anymore. They give you numbers. And just anecdotally, my mom is 81, and we have this group, my wife, my mom, and myself, and we see who walked how many steps in the last 7 days. And unfortunately, my 81-year-old mom walks more than I do as a physician in my office on my butt all day long. So motivate yourself with other people, with fitness trackers, with a calendar where you write in, okay, this is what I'm doing. And to overcome this fatigue is not easy, because your body tells you, I want to sleep, I want to lie on the sofa, I want to watch TV.
Right.
But and that's what my patients tell me, if you overcome this first resistance, and again, those other tricks might help you with that. If you overcome this resistance against the training and do it, then at one point you feel better. And almost all of my patients, or all our patients in the study, have fatigue, but they say, I know my day is Wednesday and I meet with Michaela, who is my wife, and I have to be there. And then I get up and I come. And then once I have started, or that's what they all say, once I have started, I can do it.
Okay, wonderful. There's a lot of questions about ranking the actual exercises and determine of like benefit. Would yoga be at the top? Would Pilates be at the top? I think, I mean, I'm interested to hear your answer, but I'm not sure if we could come up with a
I have
list.
one clear ranking. An exercise that you do is much better than an exercise that you don't do. Right? And do something that you like. Yoga and Pilates are, if you're smoldering and MGUS, great. I have one patient who has lytic lesions in his spine. He's always very excited about his yoga poses. He even named one after me, which is of course
Oh my gosh, I love
it's a huge honor to me.
Yeah.
But I was a little bit afraid. I mean, he does yoga for 50 years, so he really knows how to do it. I would not start something like stretching when you have no experience. You really should do that together with a trainer or with a physical therapist, because if you have osteoporosis or osteolytic lesions, then it can be dangerous. In the worst case, it can lead to fractures. Again, I have not seen it a lot, neither in practice nor in our studies, but there is a risk, and I don't want to push anyone to do something that would harm them. That is very important. Speak with your physician first before you attempt anything like this.
Okay, awesome. Is it just a follow up to that? Would Pilates or yoga be counted as resistance training?
It is, now I'm not the expert in those
Yeah, I was
two.
gonna say that's more for your wife.
Yeah, right. I think they are, to a certain degree, resistance training. If your muscles get tired when doing it, I would see that as resistance training. And resistance training doesn't need to have weights. You can do that with your body weight. So I think to a certain degree it is. Stretching is also good because it makes you more flexible. And I mean, the older we get, the higher is the risk that we maybe even fall. And if you have a better awareness of your body, you can prevent a fall much better than someone who has never worked out. That's
Okay.
maybe one thing in this regard.
Okay, wonderful. Brenda's asking an interesting question. She said she's 74 and actively being treated for myeloma and taking Zometa infusions. She wants to go downhill skiing. Would you advise against that? I love that.
I have heard this
No
question.
pressure.
But especially in Germany, in Buffalo, it's not that much of a question because everything is flat. So, but even here, I get this question. I love skiing myself, so I understand, and I feel bad to say that, but even if you're a really good skier, someone else might run into you, and that might become a real problem. And I'm not sure, in the US, most people don't know Michael Schumacher, who was world champion in Formula One, in fantastic shape. He got run over by another skier, and he's disabled now. So he did not have an accident with his Formula One race car, but he had an accident on a ski slope. And as bad as I feel, I would rather recommend cross-country skiing.
Okay, wonderful. One question that George has, his wife is struggling with fatigue after chemotherapy. What are things that you can do? What are some good ideas to help her with that? Or what are some gentle exercises to help her with that?
I think, especially right after chemotherapy, you're not up for a full workout. What I think might help, and what my patients tell me, is go for a walk. That's something, right? It's better than nothing. If you can overcome these first few minutes that are very tiresome, try to do that. Don't do it alone. If you get too tired, you need someone who can get the car and bring you home. But I think that is something that might be helpful, maybe even before, that you have some kind of a good feeling before you have to go for the chemotherapy. Of course, it also depends on the chemotherapy, depends on your immune function, because if the white cells are very low, you're more susceptible to infection, so you should not be in a crowd. But in a safe environment, I have some patients who also walk on a treadmill if you have access to that, so just to do something. And again, you don't have to do a huge amount of work. If you can do a little bit, can also already be helpful.
Awesome. There's a question that I think is very important to ask, although it is maybe a little bit uncomfortable. There's a male with smoldering myeloma, and he's wondering, is periodic standard male on top sexual activity okay? Which I think is a question that a lot of myeloma patients have.
Yeah, actually, we have a question in our study about sexual function, and that is relevant. It is part of our life, so I find it absolutely reasonable. For smoldering myeloma patients, I don't see any limitations.
Okay, wonderful. Lots of people are wondering about bone density, so let's kind of switch back to that gear. How often do you recommend a bone density assessment, and what test is that?
Yeah, so I was talking about it, and we do that for research. The literature says, and I read a lot about this, the literature says in myeloma bone density assessment is not relevant.
Okay.
Because especially multiple myeloma, in smoldering and Angus, it's a different setting, but in symptomatic multiple myeloma with osteolytic lesion, it depends very much. Usually we do bone density assessments, and they're called bone density measurement or DEXA scan. Those are two very similar techniques. We do them on the lower spine and on the hip. And then you know how your density is. And for someone who has systemic osteoporosis, or someone who just wants to know what their bone density is, that is okay. For a myeloma patient who has an osteolytic lesion in their right arm, it doesn't say anything if you do a bone density scan on your left leg, right? So that's the problem, why all the studies that have been done in myeloma are not very helpful. But in general, for MGUS and smoldering, above a certain age, might make sense to do bone density scan, especially if someone in your family has osteoporosis, because there's a familiar kind of connection, and women in menopause also have a higher risk of lower bone density, and there it might be helpful to take calcium and vitamin D supplements.
Okay, wonderful. Just along that same line, I believe Xgeva is a bone strengthener like Zometa, and people are wondering, you know, when it comes to wanting to change the dosing, is that even an option, and who do they consult with?
Yeah, that should usually be done with your hemato-oncologist, because it depends. The dose is usually set and only dependent on the kidney function in the bisphosphonates. With the denosumab, some effect of the kidney function, much less so. And usually there's a standard dose that you should take, because they have been studied in large clinical trials, and they have shown over and over again that both denosumab, which is Xgeva, or Zometa, which is zoledronic acid, both are beneficial. One study showed overall survival for the Zometa, another study showed progression-free survival for the Xgeva. Those two are approved, and they are very helpful. They have unfortunately similar side effects. The difference is a little bit when it comes to the denosumab, that it keeps these osteoclasts, these bone-eating cells, in a very immature stage. And when you stop the denosumab, you can get an overshooting reaction of those, and then you can get a hypercalcemia, because those cells eat up the bone and get too much calcium out of the bone. But again, that might be a little bit too far away from our topic today. Both are recommended. Either is recommended in multiple myeloma. Yeah.
Okay, wonderful. Paul is wondering, he said, thank you for the information. He's wondering about imaging. Is a full body MRI the protocol for smoldering myeloma as opposed to a PET or CT scan? And he doesn't want to get another PET scan if not necessary, if the MRI is just as effective.
In early stages, MRI is as effective. The data is, there are three studies, two used MRI, one used PET-CT. Both showed that they are good in smoldering myeloma. The guidelines say a low-dose CT is good, but that was mostly based on the fact that it is more available all over the world, because it's an international guideline. In my practice in smoldering myeloma, I use only MRI, because MRI has the highest sensitivity to see infiltrations in the bone marrow. So therefore, I recommend bone marrow MRI. Yeah.
Okay. Wonderful. Tim is wondering, he has smoldering myeloma as an active marathon runner, and he is taking iron for low red blood count. It coincided with an increase in training. So can you develop runner's anemia if you are too intense in your exercise?
That could be, if you're very intense, you can cause either cell lysis, which is if you're really extreme, and you can also, one caveat, I have worked out with a friend, no myeloma, who developed actually rhabdomyolysis, where the muscles dissolved. So,
oh my gosh.
he got kidney issues. There is a kind of a too much extreme, but if you do it for a long period of time already and have always done it, then you should be safe. Someone who just starts should start slowly, and maybe with a trainer, with someone who knows something about it. And with the cell lysis, that has to be very extreme. And the iron, again, iron is, if you have maybe even a slight iron deficiency, taking iron might help, but you should not take too much iron, because your body doesn't know what to do with it and stores it in your liver, which is then on the long run also not good. Right. So only take it if you really need it.
Okay, wonderful. Just one more question to finish it up. When walking, is there a certain pace that should be maintained?
There are recommendations depending on your age. And again, you find that online, there are formulas which pulse rate you should attempt to have. But that again also depends on if you have always been walking a lot or if you are just starting. So if you're just starting, it might be a little bit different than someone who was always a runner, for example. So there are online, you can look up what you recommended depending on your age, depending on your resting heart rate, what would be the recommended pace that you should walk.
Okay, perfect. Thank you for being here with us tonight. It's so exciting, and we did go longer than we planned, but I loved being able to tackle all of those questions, so thank you. I'll just finish. Mark says, since the effects in response to treatment of myeloma are so person-specific, shouldn't the patient's medical team be more involved in prescribing an exercise program, especially patients who have gone under a stem cell transplant? The answer is yes. Let's advocate together and work together with our medical teams so that becomes the normal, regular thing that happens. We completely agree with you, Mark, and we'll advocate with you for that. I'll finish up with just a couple more slides. If I can get those pulled up. Can you see those okay? All right, so next session, we are going to talk about the relationship between diet and myeloma progression. Let me make sure.
It's black.
There we go.
I know it. There it is.
Is that working? It was like kind of wigging out, so I decided to reload it. Okay. Next session, we are hoping to talk about the relationship between diet and myeloma progression. And we are working with Dr. Irvi Shah, who is going to find the best availability for her, but we will be in touch with all of you about the next event. Just as we're studying fitness and myeloma progression in this chapter, we also wanted to discuss the relationship between diet, as Dr. Hillengass mentioned during his presentation. You may be interested in other community events we have coming up. On the 7th is our Myeloma Financial Coach chapter. We'll be talking about good debt versus bad debt, and what does that mean for myeloma patients and their families with Myeloma Financial Coach Diana Valentine. That night at 7 p.m. is that's actually the date has changed. Is going to be Thursday, September 9th at 7 p.m. Eastern is going to be our myeloma caregiver chapter. The topic will be boundaries, learning how to make and keep them for everyone's benefit. And that's with licensed social worker Nora Miller, who's also a myeloma coach. Tuesday, September 14th at 6:25 Pacific time, that's Central, but it is Pacific, is the SoCal Myeloma Community Chapter. We'll be joining with Dr. Fotis, who is a multiple myeloma specialist at UCSD, who will be talking to us about the importance of knowing your genetics and what to do about this knowledge. On the 21st at 1 p.m. Eastern is the Myeloma Financial Coach chapter. Again, the reason we're having two sessions is because we're going to be talking about Medicare fundamentals and changes, what we need to know for open enrollment, because that's such a timely event. We wanted to include that one for our myeloma patients and their caregivers who might be on Medicare. The link to sign up for any of those events and even more events I have not mentioned today is found at the bottom of this slide and will be sent out in the follow-up email, along with all the resources that I mentioned today within 48 hours of the event's completion. Once again, a thank you to our sponsors, Bristol Myers Squibb, Takeda Oncology, Karyopharm Therapeutics, Adaptive Biotechnologies, Oncopeptides, Janssen Oncology, AbbVie, Sanofi, Amgen Oncology, and Genentech. And thank you again, Dr. Hillengass, for joining us. Thank you for your attendance, everybody who came, for helping us build a strong myeloma crowd community. I appreciate you so much, and I hope you have a great rest of your night. Take care.
Thank you so much. Have a great night. Bye-bye.